Welcome everyone to the latest episode of the Dr. Abs Healthcast. And on today's episode, we're going to talk about a subject that is actually really near and dear to my heart. The reason being is that I see it pretty much every day in my practice, and that is neck and back pain. Now, just to basically give you guys an idea of how big of an epidemic this is in this country, I just want to review a little bit of some facts, pretty much some back pain facts that we've accumulated from research and published studies. So to start off, it is estimated that back pain afflicts over 31 million Americans and is the #1 cause of activity limitation in young adults. Within a given year, up to 50% of US adults suffer from back pain. Americans spend at least $50 billion each year on low back pain, and it's the second most common neurological ailment in the US. Low back pain is the second most frequent reason for visits to the physician. 80% of people over the age of 30 will experience back problems at some point in their lives, and 30% of those people will have recurring problems. Each year, there are approximately 916,000 spinal surgeries performed in the United States, and the back was involved in almost 1/4 of all occupational injuries and illnesses. Now, I don't know about you guys, but these are some astounding facts, and for that reason, I wanted to bring in somebody that is an expert when it comes to resolving back pain in a more natural and non-invasive way. So with me today, I have Saleem Musallam. Did I say that correctly?
Pretty close.
Pretty close. So basically, Salim is the president of Excite Medical, the manufacturer of the DRX 9000. Now, the DRX 9000 is the most advanced non-surgical true spinal decompression system in the world, and Salim is the foremost expert in medical devices, specifically in the field of quote unquote true spinal decompression. So Salim, welcome to the show.
Thank you. Thank you so much for having me.
Now, Salim, just to give everybody a little bit of background on you, just tell us how many years you've had in this industry and pretty much talk about any highlights that, you know, of those years that were related to this spinal true decompression.
Sure. So I've actually been in the industry now 16 years, and I've enjoyed it quite a bit. I mean, I got to tell you the drastic stories that I've heard from patients and from providers about how true spinal decompression, how the DRX 9000 has changed their life for the better, it's a never-ending story. I hear it all the time.
Yeah.
I've traveled to over 40 countries. The DRX 9000 is in over 50 countries around the world, and over 40 states in the U.S. It's more than 1,000 clinics.
Wow.
So we have quite a bit of experience, and I've actually submitted 7 different patent applications related to my technology.
Wow, that is amazing. So obviously the subject today is neck and back pain, and we all know that a lot of people out there have poor postural habits, and you know, these bad habits are basically affecting a lot of parts of their body, their joints, their discs, their muscles, and you know, this can technically lead to degeneration of the spine. You know, we have a lot of occupations out there where people are carrying heavy loads that basically translate over to their spines. A lot of people are out there, you know, in awkward positions, you know, in positions where they have to maybe bend over at work. And, you know, all these positions and habits that people have today are basically contributing and can pretty much put their backs at risk. So I want you to talk about the traditional methods of treatment that, you know, the ones that you mentioned, a lot of people might know about, and maybe they think that that's the only option. And then I want you to compare that to the DRX 9000 true spinal decompression system and why that just stands above all the rest.
Sure. So specifically, what the DRX 9000 treats are herniated disc, bulging disc, degenerative disc disease, and even stenosis. So to kind of just give you a few different walks of life, what kind of conditions they've had, what kind of options they have, and what the what spinal decompression with the DRX 9000 can do. You take somebody that's been in an accident, for example. Okay, somebody that's been in an accident, as you know, Doc, the vertebra is made up of different bones, and they're separated by discs. And each one of these discs has a like a rubber band on the outside called the annulus fibrosus. And in the center, there's like a jello-like substance called the nucleus pulposus. So to kind of take a step by step, we can start off with a herniated disc or a bulging disc. That can happen from an injury. A lot of times it happens with car accidents, or it could be a mechanic throwing around a tire.
Sports injuries.
Sports injuries. And so what a bulge is when, as you know, I'm just sharing this with the audience, it's when that nucleus pulposus, that jello-like substance, pushes against the annulus and pinches a nerve. Or in a case of a herniation, it actually breaks through that annulus and pinches the nerve. So most patients that have back pain, whether it's from that or any other condition, their first step is to try to take something at home, you know, like an aspirin, and then they go to the doctor. And in primary care, typically they start off with medicines to try to alleviate that pain, hoping it's going to go away by itself.
Yeah.
And if that doesn't work out, they try physical therapy. They try, sometimes they go, if that doesn't work out, the next step in traditional medicine is to go see a pain management specialist. And that could be either they're writing prescriptions or they're doing injections. And these injections typically are a series of injections 3 times over 6 weeks. And they work temporarily because all it does is mask the pain. So keep in mind, I mentioned what a herniated disc, which is when that like jello-like substance breaks through and pinches the nerve. But another common one is degenerative disc. So this happens with older people, especially smokers. And that's, you know, that's a fun fact. A lot of people think that smoking just affects the lungs. But
it ages you quick.
Right?
Essentially, yeah.
Yeah, and that's because it dehydrates you from the inside out. So, you know, a lot of people talk about, well, yeah, I know it's not just the lungs, it can affect your skin, but it also can affect your back. So if you got back pain and you got neck pain and you're a smoker, stop smoking and start hydrating.
Absolutely.
Yeah. So degenerative disc basically is that loss of that disc space, as you know, and it happens with the geriatric population happens quite a bit.
Yeah.
And when that happens, the two vertebrae, they come against each other, and again, you're pinching a nerve. So when they do an injection, basically it masks that, but it doesn't increase the disc height. You know, it doesn't increase the disc between the bones or the vertebra.
Essentially, it doesn't get down to the root of the problem.
It doesn't
essentially
treat it. No.
Puts
no.
a Band-Aid over the area.
Correct.
You don't feel it for a while, but
Correct.
the problem is still there.
Sometimes that pain relief can last 6 months, sometimes up to a year. And then it would return, you know, depending on the conditions you have. Then the next option from that is, well, this is 2020. So it used to be you went straight to surgery, but now they have these minimally invasive procedures. It's still a surgical procedure. They're still going into your back.
Yeah.
You also have, besides the minimally invasive, they are doing pain medicine that's injected directly using a pump. So patients are literally walking around wearing a pain pump.
Oh, wow.
That has leads going right into their back.
So it's like a time release type of
That's
medication?
Correct. That's
wow.
correct. So, you know, quite often that's seen in patients that had failed back surgery and they really don't have any other options.
Yeah.
Right? And then we talk about surgeries. So when you look at surgeries, well, there's all kinds of different procedures that they do. They can do bone-on-bone fusion. Essentially, they take out the disc and
just fuse the bones together.
fuse the bones together.
Yeah.
And they do that a couple of ways. They can do that using like a kyphoplasty, or they can do that with actual hardware. So the primary issue with that is it's not natural for the patient.
Absolutely.
And when it's not natural, what happens is the discs above and below are now carrying the load. So you have to think about your body, right? And it's got these vertebrae. Nobody's born, missing the vertebra L3, L4, or L5S1. And if they are, that's a deformity, and that's, a highly improbable thing. But I'd say 99% of the population, you have all your discs, and you have them for a reason, and they're all equal in their role.
Yeah.
So when you take one out, that puts a bigger load on the discs above and below. And if you know anybody that's had discs fused, just ask them, how many?
Yeah.
Starts off with one. Now you increase the discs above and below, and that's kind of the route. So the average neurosurgeon, there's two types of surgeons that do surgeries for disc issues: orthopedic surgeons and neurosurgeons. Mm-hmm. It used to be just neurosurgeons. Now it's orthopedic surgeons, neurosurgeons. The average surgeon will tell you that surgery is the last option. And if they don't tell you that, be careful.
And they can't essentially guarantee that it's actually going to work. I mean, obviously,
None
it's a risk. It's a huge risk.
100%. None of them can guarantee it. But again, what are they going to do with the surgery?
Correct.
They're going to take out a disc? Are they going to implant something? So these are things that are going to affect you for the rest of your life.
I got you. Now, turning to the DRX 9000
Absolutely.
True spinal decompression system, how is this just a step above everything you just talked about?
Sure. So the DRX 9000 pulls. So basically what we do is we put a patient into, for the lumbar, we put them in two harnesses. And it's a pulling mechanism where we're pulling gently on the pelvic region on your hips.
Gotcha.
And we keep your upper body stable. And with our cervical unit, you lay your head in a headrest. Now, with both of our units, our lumbar, which is low back, and cervical, which is neck, we can actually change the angle of pull and target a specific disc. And when it comes to the neck, the DRX 9000 has the world's first and only non-surgical true spinal decompression that can target a specific disc level in the neck.
That's amazing, because I feel like when somebody says decompress or pulling,
sure,
it seems like you would be pulling everything: muscles, ligaments, tendons, including the spine and the discs.
And that's where spinal decompression comes in. So the industry really took off in the early 90s. There was a Canadian doctor, he was an MD PhD, that was inspired by astronauts coming back from space and sharing stories that, number one, they're taller, and number two, that they don't have back pain when they're when they're in outer space. So he wanted to recreate that condition here on Earth, and so he came up with non-surgical spinal decompression, and he pulled using a specific pull. It's called the logarithmic curve. Basically, it's the way we pull. And the DRX 9000 pulls in that manner. It's actually the only device in the world that pulls in the same manner as Dr. Dyer's technology.
Wow.
So Dr. Dyer's technology really took off when a study was done that they inserted a cannula, basically like a needle with a measuring device, inside a patient's disc during treatment. And they were able to see the pressure drop. So,
Wow.
As you know, Doc, in our spine, we always have positive pressure, right?
Yeah.
And pressure in the vertebra is measured by millimeters of mercury. So
Okay.
we always have positive pressure. So when we're laying down, there's positive pressure on your discs. When you stand up, pressure increases. Bend over, it increases more. Bend over and pick up something heavy, and it really increases.
Yeah, multiplies. Absolutely.
So with the DRX 9000, what we're able to do is pull on the vertebra and keep the patient completely relaxed and actually keep the muscles relaxed. So the body has a natural defense mechanism called the proprioceptive response, and that causes the paraspinal muscles, or the muscles that guard that vertebra,
To contract.
and hold on and protect it.
Gotcha.
So with the DRX 9000 and pulling on that logarithmic curve, we're able to pull and keep avoid eliciting that proprioceptive response. Basically, keeping that that response at bay and keeping those muscles relaxed, and we're able to open up that disc space and drop the pressure inside the disc.
Wow.
To by more than 200 millimeters of mercury, and that's been proven with the study where they inserted a cannula inside a patient's disc.
Now you touch on an interesting subject, because obviously everybody out there, you know, everything you're saying right now sounds absolutely amazing, but a lot of people, you know, they're always skeptical. They want to know, hey, is there any peer-reviewed research on this device? Now, obviously, you've already talked about a little bit about the research. Can you talk about any other type of research that's been done?
Yeah, absolutely. So prior to touching base on that, I just want to finish how the DRX treats.
Okay.
So basically, by us dropping intradiscal pressure, so in a case of a herniation or a bulge where that nucleus pulposus pushes out against the annulus and then pinches a nerve, or breaks through and pinches a nerve, by creating a negative pressure, we're able to open up that disc space and bring that nucleus back into the center. So when you ask about research, I did mention the research about the original study where they measured the intradiscal pressure. The DRX 9000 has pre and post MRIs, studies that were done using pre and post MRI, meaning they took an MRI of a patient prior to
And post.
and then they took it after. And they were able to show the disc going back into the center.
Wow.
Now, with degenerative disc disease, that's where you have the loss of disc space.
Dehydration, yep.
By the DRX pulling on the vertebra without having the muscles contract, we're able to bring nutrients and fluids back into the disc, heightening the disc space.
So essentially it's hydrating the disc.
Absolutely.
Wow.
And that's been proven with a peer-reviewed study showing an increase in disc height, along with a correlated decrease in pain score. Now,
Wow.
the studies that were done on the DRX 9000 are often quoted by other machines out there. Call them copycats. But anytime you actually read the research, the device that was used was utilizing the DRX 9000. And whenever you look at a study, you have to look at not just that it's peer-reviewed, but who wrote it,
Yeah.
who authored it, who was involved in that study.
Was it an unbiased study? You know, was it the company who created the machine?
Right.
Yeah, this was independent.
The studies that were done on the DRX 9000, the majority of them were done by doctors from the Mayo Clinic, like Dr. John Leslie with the Mayo Clinic, Dr. Joe Pergolesi at the time that the studies were done. He was with Johns Hopkins. Dr. Alex Macario, he's with Stanford. Dr. Christian Apfel, he actually used to be with the University of California, San Francisco. You know, and then you're also talking about like T.J. Gann from Duke University. So these are not, you know, physical therapists or, you know, theorists doing these studies. These are medical doctors that are associated with the most prestigious medical institutions that we have in the country that did these studies. And, you know, just to kind of give you guys kind of a look on this slide, there is a change in the pain score. So with this study was done by Dr. John Leslie from the Mayo Clinic and others. Basically, the average pain score of a patient, as you can see on the far left, was above a 6, and after a 6-week treatment, it dropped to below an 8, which is pretty incredible. And on the next slide, we look at the Oswestry score. Now, the Oswestry score is a score that measures the lifestyle of somebody. So let's say they have, they don't just have pain, but, you know, when you wake up and you take a shower, are you in pain? When you tie your shoes, are you in pain? Are you able to drive to work? That's what we look at when we look at the Oswestry scale, is the quality of life. And the higher the Oswestry score, the worse off they are, basically.
Gotcha.
So with these patients, it dropped to below a 6, which is pretty incredible.
Wow.
And these are not acute patients, meaning these patients have, the average patient in this particular study had a pain score, had pain for, on average, more than 10 years.
Wow.
On this next slide, which also looks at the pain score, this study was published in 2010, and it was headed by Dr. Christian Apfelt from the University of California, San Francisco at that time. And prior to the DRX 9000, their pain scores was about a 6, and after was below a 1. But this study in particular, when you look at this slide, it should be on your screen right now, called Disc Height, there was an actual increase in the patient's disc height. So this study was looking at pre and post MRI, looked at the MRIs before and looked at the MRIs after. Mm-hmm. So not only do we know our technology works, but it's documented. But the most important part about it is it's non-surgical, it's non-invasive, you can continue to go to work. It truly is the most advanced non-surgical alternative to surgery.
A lot of my patients, including myself, I think everybody suffered from back pain at some point in their life, and I personally know that it infiltrates your mental, your mood, pretty much everything's affected, your activities of daily living. Now, you mentioned some of the conditions that it treats. Can you just talk a little bit about, is this just for, let's say, a chronic situation, or can people that have an acute situation as far as back pain, can they also be treated with a DRX? Is it pretty much for both acute and chronic back pain?
So, as much as I'd love to sit here and tell you that it's for everybody, it's not. Okay. It's not. It's for your more serious cases that are not responding to typical therapy. Gotcha. So what I would advise everybody to do is to find a DRX 9000 certified provider near them. Go to them. The majority of them, I'd say 99% of them, provide a free consult. Because if it's something simple, maybe they don't need sessions on the DRX. Maybe something else that the provider's doing in their practice can help. Yeah. But they need to come in.
Absolutely.
And there's some patients that also you cannot put on there, and if you have a patient that has hardware in their back, for example, you can't put them on there. They need to have stability in their spine. There's a condition out there called spondylolisthesis. Yep. Right, and that comes in 4 grades. If they're too unstable, you can't put them on. If they're pregnant, you can't put them on. If they have cancer in the spine, you can't put them on. If they have hardware in their back, you can't put them on. So there are certain patients that simply don't qualify.
Gotcha.
for medical reasons, and then there's others that don't qualify because they're just they may not need it. So the best thing to do is to really go in.
Just get evaluated by the practitioner, and they'll basically determine whether you're a good candidate for the treatment or not.
Absolutely. And make sure you have an MRI. But the doc, the provider, they're going to be doing a physical exam on you as well, because they can't just look at the MRI. They also have to do a physical exam to identify which nerve root is generating the most pain or the conditions that they have. So they need to come in for these things. And like I said, it's just 99% of the providers, and they can visit drx9000.com, go on the contact us page, send us their zip code, and we will send them the closest DRX9000 certified provider near them.
And just to recap, just so the audience understands, obviously you're going to go into your provider, they're going to evaluate you, do a physical exam, potentially evaluate your MRI study, or whether maybe they have to send you to take one. But as far as the actual conditions that the DRX9000 true spinal decompression can treat, it mainly focuses on disc herniations, disc bulges, facet syndrome.
Absolutely.
So as far as diagnosis,
right,
it's key that the provider, accurately diagnoses the patient.
Absolutely, absolutely. I was recently at Dr. William Martin's office. Dr. William Martin is a Stanford alumni. He's an interventional radiologist. He's actually double board certified, and he has his own MRI machines. And he actually conducted that study in the early 90s where he inserted a cannula inside a patient's disc, measuring that disc space. And I bring him up because, he not only do I enjoy listening to his enthusiasm about the DRX9000, but he's been doing MRIs on every patient before and after, every single patient, before and after they get treated on the DRX9000.
And that's so powerful because the patient can see, hey, look, this is how it was before,
absolutely.
And then now look at me after, and it's like
and
a huge
in Dr.
difference.
Martin's words, when you have a case like stenosis, right, I felt kind of silly because I personally, even though I manufacture this machine, I couldn't digest how can we make a disc that has become narrow wider. And in Dr. Martin's own words is because there's so much nutrients and fluids come back into the disc, we actually make it more plump. So we do, so he has it. He found it to be highly effective in stenosis. He found it to be highly effective in patients with facets because, maybe some people in the audience don't know what facet syndrome is, posterior facet syndrome. But, as you know, Doc, it's the two bones on the back of the vertebra. When there's a loss of disc space, they touch each other and they can pinch a nerve. So by heightening that disc space, that's how it treats posterior facet syndrome and degenerative disc, herniated discs, and bulging discs. And
I see it also can treat sciatica, which is a big problem for people in the community.
Absolutely, yeah. So some of the conditions. So we talked specifically about the conditions in medical terms, but we really didn't talk about the symptoms, right? So some of the symptoms that can be caused and are often caused by a disc-related issue are things like sciatica. So when you have that pain running down the side of your leg,
the numbness, the tingling, shooting pain.
Neuropathy. That's a big thing. If you have tingling in your hands, sometimes they suspect carpal tunnel, but quite often it's coming from the neck, coming all the way down.
That's misdiagnosed, yeah.
If you're having migraines, it could be shooting up also from the neck.
Yeah.
Just think about your vertebra. We got a beautiful thing here that you got here, Doc. I like it. And right down the entire thing is your spinal cord.
Yep.
And, here we got all these yellow things coming out the sides, left and right of the vertebra. These are all nerve roots.
Yeah.
And all of the nerve roots, as you know, Doc, they end at the skin. So literally they go from there to your hands, to your fingers, to your feet. So if you have debilitating back pain, neck pain, if you have numbness and tingling in your hand, if you have numbness in your feet, if you have migraines.
Essentially, that's like the end result, but the true root of the problem is actually in the spine. And that's where the DRX 9000 can basically help.
Absolutely. And we're treating the root problem, that's causing that condition.
Absolutely. So I want to touch a little bit on as far as what can a patient expect during the treatment, because this sounds absolutely fascinating to me, and I'm sure a lot of the listeners out there, once they're on the table, does this hurt? What kind of side effects are there with this treatment? Can you talk a little bit about that?
Yeah. So, most patients, when they see the DRX, it's so, it's very large. And actually, I'll bring it up right now so that we can kind of show it real briefly. All right, so on the screen right now, we just brought up a picture, it should be on your screen, of the DRX 9000. It's pretty big. And when patients see it, sometimes they're a little intimidated. But most patients actually fall asleep during the treatment. So keep in mind that again, the way we achieve our end result is by keeping the patient relaxed, keeping the muscles relaxed.
So this is like a slow pull. It's not necessarily like they're yanking on your pelvis and stretching your low back in an aggressive manner.
It's a very gentle pull, and one feature that we have in the DRX 9000 that doesn't exist in any other technology is that it can adjust itself 13 times per second.
Wow.
And so when it's pulling, if it feels any sort of movement with the patient, it adjusts itself so that it can continue a very smooth and relaxing pull.
Not to wake up the patient, essentially.
Yeah, absolutely. We even have headphones for the patient to listen to some relaxing music. I don't know how many videos I've seen of patient testimonials saying that that's the best sleep they've had in a very long time.
Man, I don't know about anybody out there, but this sounds way more conducive. I don't know about everybody out there, but this sounds way more relaxing and way less risky than any type of surgery or injection out there.
And back to a point that I forgot to go on just about a tad bit. You were asking me about what kind of patients go on.
Yeah.
And athletes, I will tell you, absolutely love the DRX.
I can imagine, because you look at football players, it's like literally they're getting, every week they play, they're essentially getting into a mini car accident week after week after week. So, herniations, when these guys retire, they might have the spine of a 60-year-old and they're only 30.
Yeah, football players. If you think about basketball players, every time you jump and you land on your feet, think about baseball players as you turn and you throw that ball.
Yep, the torque. Absolutely.
So it doesn't matter what kind of athlete. There's a lot of athletes that get on it as prevention. Because through true spinal decompression, we offer what I like to call true disc hydration therapy. And so a lot of major league athletes, they absolutely love getting on the DRX for that purpose. So don't just think about patients that have had accidents.
So essentially it's very versatile, anywhere from, your professional collegiate athlete to the elderly to your weekend warrior. I mean,
So-
this can work with anybody.
So there's I can't mention their name specifically, but I can tell you that there was a starter in the Major League Baseball that got thrown down to the minor leagues because of a herniated disc. Got treated on the DRX, and they're a starter again.
Wow. In the majors.
In the majors,
Wow.
yeah. And actually, I know of a few of them. But, you know, when you think baseball, you think football, you think golf is actually one. Frank Nobilo.
I mean, look at Tiger Woods. He's been dealing with back issues for
And
the longest time.
I wish I could have gotten a hold of him. Frank Nobilo got treated on the DRX 9000. Ernie Els. I mean, these guys were, top in their game
Champions,
when they were.
yeah.
Absolutely. So, Retief Goosen is another one. They're, they don't have to worry about signing a big contract. So, it's okay to mention their names. But, yeah, I mean, for athletes, it's huge, to be able to provide them with true disc hydration therapy.
Get them back on the playing field. I mean, that's the ultimate for them.
Absolutely.
So I want to touch on, so obviously we've talked about the ideal patient for this treatment. We've discussed how this unit is pretty much unique in that it could target individual discs in the cervical and the lumbar spine. So I was reading a little bit on it, and I saw that there's a protocol essentially for the DRX treatment, and it's 20 sessions.
Mm-hmm.
So can you just talk a little bit about that, as far as why that many sessions is necessary, and just discuss the protocol in general?
Sure. So at minimum, you need 20 sessions.
Okay.
And the reason, they got to look at it like an antibiotic, right? You start taking antibiotics, you feel good, but they want you to finish the entire course. So most patients begin feeling relief within the first few sessions.
Oh, wow.
But the condition is still there. It's
Yeah.
improving. So they need to finish the 20. And sometimes they go on to 24, just depending on their condition.
Yeah.
Dr. Martin does a minimum of 24 on everybody, because with him having his own MRI unit, he's watching
Of course.
the disc height goes up. And so you need at least 20 sessions.
And that's the peer-reviewed, studied amount of treatments?
All the studies that were done using the DRX 9000 were done with 20 sessions.
Got it.
And
the 20 sessions are performed over a span of
6 weeks.
6 weeks.
6 weeks. And each time you're going to go in for about 30 minutes. And then they have some other therapies, that they're going to do after, like e-stem and ice. But it's basically you're on the machine for the exact pull is about 20 minutes and 15 seconds.
It's amazing, because I feel like, we're in the instant world nowadays. It's 2020. People want to feel better right away. So, I think that's why sometimes people do turn to the medication, because it'll shut the pain off. But something like this, I feel like it's so much more worth it, in the sense that you're actually targeting the root of the problem over a span of 6 weeks, 30 minutes a session. You're basically falling asleep during the treatment. I mean, I feel like you can't beat that.
Something that just hit me that I never thought of before is comparing what we have going on with the DRX 9000 to weight loss. So, for example, you can go get a quick fix, right?
Yeah.
Somebody weighs 400 pounds, they can go and get a lap band surgery.
Yep.
Because they don't want to change their lifestyle.
Exactly.
They don't want to change the way they eat, And maybe I'm sounding a little bit cold when it comes to that.
Yeah, not to knock those surgeries. Like, sometimes, obviously, they do have life-threatening situations, and they need the surgery.
Absolutely.
But we're just talking in general terms.
I will tell you firsthand, my brother did that. He wouldn't change his lifestyle, so he went and he had, he didn't do the one with the rubber band. He actually had his entire stomach bypassed.
The gastric bypass,
and he could hardly eat anything. I mean, So if I didn't see it happen in my own family, where I know that my brother had a choice and he could have changed his health habits rather than doing surgery. Bottom line is, when somebody changes their lifestyle and becomes more healthy to lose that weight, quite often, research shows that it's longer lasting than the ones that throw a rubber band around their stomach and do some quick procedure to lose weight. Same thing with the disc. You can go and do something quick, but the best way is the natural way. And if they're listening to your podcast, I got a feeling the majority of your audience is looking for that natural treatment for that that non-surgical alternative.
Yeah, I mean, this is specifically why I have somebody like you on, because part of the, my platform and what I want to do and what I want to bring to the audience is natural health solutions. A lot of problems health-wise in this country, and I just want to try to, interview the latest and greatest and, people that are in the know as far as natural treatments as opposed to, the drugs and the surgery. So you touched on an interesting subject there. Obviously, there are other tables out there that maybe compare, maybe don't. Obviously, I'll let you talk about that, but I've heard of other quote-unquote decompression or what we call traction tables out there. How does the DRX 9000 compare to those other tables?
Sure. If I was a patient, the first question I'd ask is, show me the research. Show me a study that was done using your table, not on spinal decompression as an industry. So the very first thing is, the majority of these tables, if not almost all, do not have any peer-reviewed research that is associated with any major universities. When you look at the actual word spinal decompression, decompressing, dropping the pressure in the disc, there's only been one study ever done where they measured that pressure drop, and that was using that logarithmic curve. And the DRX 9000 is the only device on the market available today that pulls in that method. That's number one. Number two, the actual table, we can change the angle of pull, and there's an air bladder that inflates underneath your low back, maintaining that natural curvature in your spine, so that depending which angle we pull at, we're targeting specific disc level.
Wow.
Now, we do that with the lumbar. On the cervical, the DRX 9000 is the only device available in the world that can target a specific disc level. Back to that logarithmic curve pull. The way we pull is one thing. The way we execute is another. So we are the only device in the entire industry that utilizes what's called a servo motor, and that has the capability of adjusting itself thousands of times per second. So what we have with the DRX 9000 that's unique, and that doesn't exist anywhere, is the fact that it can adjust itself 13 times. We have a program to adjust itself 13 times per second, ensuring that we are delivering a consistent treatment every time.
Wow.
I personally visited a doctor's office that had another table that marketed itself as spinal decompression. And the reason that, we've trademarked the word true spinal decompression is to kind of set ourselves apart.
Of course, yeah.
And I looked at a patient that walked in the door. He looked like he was pushing 300, maybe 320.
Okay.
And he went and got on this table. And the first thing that I noticed is how small it was compared to him. His elbows are hanging over the edges. So he literally had his arms, as he was laying down, he had his arms across his chest with his fingers interlocked. If you do that right now,
just to not have his arms basically fall
so
over
they
the
don't
edges.
hang.
Yeah.
If anybody that does that, your body's engaged.
Yeah, absolutely.
And when it's engaged, your muscles are guarding. You cannot possibly achieve the same results.
And you're very uncomfortable, and it sounds like you're not relaxed whatsoever.
Correct.
Yeah.
The the other thing is, I happen to have a device with me that can measure the tension of the pull. And I put it on that machine just to see if it actually delivered what it read. So the machine said that it pulled a maximum of 100 and a minimum of 50 pounds. But when it went to 50 on the machine, the measuring device actually measured 60. Now, that might not sound a lot, but the message I'm trying to deliver is the machine is not executing.
Same treatment every single time?
No. So with with the DRX 9000, we know that we're delivering a consistent treatment every single time, and the patients are going to stay relaxed and they're going to fall asleep. And on that point, there was actually a study that was done and published just last year. So this study was done. They had roughly about 70 patients. Okay. And these 70 patients, half of them were put on traction, and half of them were put on the DRX 9000. Over 70% of the patients on the DRX 9000 had a visible change in their MRI.
Wow.
With traction, less than 10.
Less than 10?
Less than 10.
Yikes.
When they looked at sciatica as the other thing, radiating pain, similar figures. So what I can tell you is not only do we have studies that looked at how a patient felt, but we have pre and post MRI studies.
So subjective and objective findings. Yeah.
You know, in the past 16 years ago, there was less than a handful of tables on the market, less than 5, that advertised spinal decompression. Less than 5. Today, there's probably about, well, not just tables. You know, on my Facebook, when I'm thumbing up, I saw an ad for a brace, a back brace that a patient wears, and they had video animation in the back brace of an increase in disc height.
It was like a pump mechanism? Yes. Oh, God.
Yeah. So the point being is anybody can make any claim.
Yeah. But obviously none of those devices, like, they were going to put forth any type of research whatsoever.
No.
Yeah.
No. And the study that came out last year, I kind of was caught off guard with it because I was about to do a presentation, and I was doing my research on the latest, and I come across this study that was done by a hospital on their own. Like I guess they got into an internal argument on
self-funded.
How could that study was 100% self-funded. You know, some of the other studies were partially funded by the manufacturer, but that's just the way it goes in the research industry. Somebody has to pay the bill. But this was like 100% on their own. It's just a random thing.
Wow.
So prior to you going in and spending any kind of money for any sort of a treatment that markets itself as spinal decompression, number one, ask them for the research. And don't just take whatever they give you and put it in your glove compartment, or just take it with you and not read it.
Do research on the research.
Just read what they gave you.
Yeah.
Read what they gave you. Number one, see who wrote that study.
Yep.
I know, I'm not going to name it, but I know of at least one device, but I know there's more, that the guy that made the machine, literally the guy that made that machine, he was the author of his own research. So we're not talking about the manufacturer funding a study.
Oh, wow.
He literally authored his own papers that they're handing out. So ask for the research, see whose name is on it, make sure that the names on the research are not employees of the manufacturer.
Of course.
Right? Or owners of that company. And number three, make sure that the study was done utilizing the machine they have. I can tell you that the DRX 9000, we have about, we're in over 1,000 clinics.
Yeah, I was going to ask you that, Salim. So this is all amazing information. I feel like people are going to be intrigued out there to know more about this. How can people find a provider in their area who actually has this machine, has this technology, and can actually perform this service.
Yeah. So just go to drx9000.com, click on the contact us section. And by the way, if you go to that website, you can click on research. All the research comes up. You can click on videos. You can see some videos about it. But you click on the contact us section and just send an email with your zip code, and we will send you the information of the closest DRX 9000 certified provider in your area. And one consultation does not hurt.
It's free.
The majority of them. I can't speak to.
That's as per the provider.
Yeah.
Okay.
I can't, but I will tell you that when we send them an email and tell them here, when we'll reply to your email and give you that provider's name, almost always they give them a free consultation.
So Salim, I mean, wealth of information. Thank you so much for coming on the Dr. Abs Healthcast. And just a little side note to everybody out there. I mean, this technology is absolutely amazing. I actually met Salim at a seminar a couple months ago, and I saw this machine, and it's impressive. I mean, the sex appeal of this machine, like, it instantly makes you ask, what the hell is that, and what does it do? And when I started doing more research on it, and we became friends, and we just started talking about, this amazing machine that you had, I knew that this was something that I could help my patients with. So I knew I had to have it. So for any of you out there who's, suffering from back pain, neck pain, the DRX 9000 is absolutely the most non-invasive, relaxing alternative to drugs and surgery that there is out there on the market today. So if anybody's looking to have a free consultation with myself, I am actually now a certified DRX provider in the Miami area. Come on down so we can get you better real quick. Take care, guys.